right, guys, so put down the beer and I want you to really listen to this because this is really cool what I'm going to tell you right now. In the beginning of my career, I started really focusing on the buttock area, more so in females, and how to give a contour and shape and everything, and ended up writing a book on that. My next phase of my life now is I'm working on even perfecting my sculpting abilities even more, and guess who is up? It is the guys. And what are we doing with guys? Well, it's absolutely transformational. It's unreal because I'm able to sculpt your body and give you a body that you would never probably even get with trying to go into the gym. Because there's some people that just can't get rid of that layer of fat. They can't get defined. They've got to work like crazy. They end up eating well, working out, and they're still not where they want to be. So what I do in the Adonis is that I go in there and I sculpt you. It's about knowing where to remove the fat and where to keep fat. Here's the thing. To create definition, you need a hill and you need a valley. The bigger the hill, the lower the valley, the more definition you're going to get. So what's the issue? Some guys don't have much of a hill because the muscle is not very well developed. It's just genetics. So what do? Well, I can create the hill by keeping fat on, but nobody wants to feel fat. So I take the fat down as much as I can. And then I use ultrasound guidance. This gives me a direct visual look at the muscle so I can inject the fat precisely in the muscle where I want to put it. It's amazing. It's like a homing pigeon. And so what happens then is that I take the ultrasound and I inject your muscle groups. In the Adonis, I'm working the entire body, every single muscle group that I can. So I start off by working on the stomach. I give you a six-pack. I put a little bit of fat in the external obliques, some fat in the rectus muscle, transversalis, which is the one that goes into the groin. Right now I've sculpted there. Now I go up and I start working on the chest. I sculpt your chest. I sculpt it right in here so you can get that nice definition between the shoulders and the pectoralis. I clean all this out. There's a triangle in here. Here's your pectoralis. Here's your latissimus. That triangle needs to be cleaned out so that you can give really nice definition. And I clean all that out. Then I take fat and I inject it into the chest and I put it in the muscle. People say, well, I don't want to be fat in my muscle. You're not, because fat is interesting. It takes on the property of where you inject it. So if I put it in muscle, it feels like muscle. Next to bone, it feels like bone. So it's not like you're getting fat. You are going to look like you've been jacked up and pumped up, like you've been going in there all the time. So I'm just making your muscle bigger. I define you, creating a valley, fullness, giving you the hill. So once I've cleared this out, I put fat in the chest, but not down here. I don't want to give you man boobs. I mean, you don't want a Victoria's Secret bra. You get good deals, but you don't want one. So what I do is that I inject it more up top. Then I inject the shoulders. Now I go into the shoulders and I define the arms. So I give you a beautiful little line in here that defines the shoulder. I define the arm down in here. I'll put fat in the shoulder, biceps, and triceps. So now I'm building this body amazing. Now I flip you on your side, I continue adding fat, and when I go face down, now I can work on your latissimus, this muscle, and I bring that out so you look more like a swimmer. The Adonis is becoming very popular. Bottom line is that I can take fat from anywhere that you got it and put it in the different muscle groups. Guys doing liposuction in the past or plastic surgery were about 5%. Now we're up to about 10%. We're starting to have open minds about this. And I got to tell you, when you see these results, it is just amazing.